Howdy, my name is Ashley Guzman, and today I will be discussing the use of fentanyl provided by the slides my partner made, Liana Alonzo. The question is, what is fentanyl? Fentanyl is a synthetic opioid that was first synthesized in 1959 by chemist Paul Janssen. Unlike drugs such as morphine, which are derived from the opium poppy plant, fentanyl is completely man-made. It was originally developed to help treat severe pain, especially for cancer patients, surgical patients, and individuals experiencing chronic pain. Because fentanyl is extremely potent, it became very widely used in medical settings for pain management. However, fentanyl is extremely dangerous. It is estimated to be about 50 times stronger than heroin and around 100 times stronger than morphine. Due to its high potency, even a very small amount can lead to overdose and death. How is it affecting? College students face many challenges during this stage of life. They often experience high levels of academic stress, stress from maintaining grades, financial concerns, social expectations, and mental health struggles such as anxiety and depression, and the list can vary. These factors can increase the likelihood of experimenting with substances. Additionally, many students may not intentionally even seek out fentanyl. One of the biggest concerns today is the rise of counterfeit pills. So, illegal drugs that appear to be prescription medications may actually contain fentanyl without the student's knowledge. Because of this, students are often taking less dangerous prescription medications. They may unknowingly consume fentanyl, which greatly increases the risk of overdose. The aspect of addiction we are emphasizing is drug dependence and overdose mortality. Drug dependence occurs when the body adapts to repeated drug use. Over time, the brain becomes reliant on the drug, meaning that larger doses are needed to achieve the same effects. This process is known as tolerance. If the person suddenly stops using the drug, withdrawal symptoms can occur, including severe muscle pain, nausea, insomnia, anxiety, sweating, intense cravings. Because fentanyl is so powerful, dependence can develop very, very quickly. The drug affects opioid receptors in the brain and produces intense feeling of euphoria and relaxation. These pleasurable effects reinforce repeated use, making it difficult for individuals to stop using the drug overall. One of the most serious negative consequences of fentanyl is overdose mortality. Opioids can slow down the body's central nervous system and can significantly reduce breathing, meaning the person may stop breathing entirely. As a result, that can quickly lead to brain damage or death if treatment is not provided immediately. Negative consequence of chronic fatality, fentanyl, is opioid-induced hyperglycemia, also known as OIH. This is a condition in which long-term opioid use can actually make a person more sensitive to pain. Ironically, patients may end up experiencing more pain than they did beforehand starting opioid treatment, which can further contribute to dependence because they may continue taking larger amounts of the drug. And now, several factors contribute to fentanyl. One of those being vulnerability. Fentanyl produces an intense feeling of euphoria and relaxation by rapidly activating opioid receptors in the brain. These pleasurable effects strongly reinforce repeated use, leading up to the risk of dependence and addiction. The overprescribing of opioid pain medications during the 1990s and the early 2000s increased opioid misuse nationwide. As prescription opioids became more restricted through prescription drug monitoring programs and prescribing more guidelines, illegal fentanyl became more prevalent in the illicit drug market, including counterfeit pills that are accessible to college-age students. College students are at a unique stage in life where they are experiencing increased dependence, trying new experiences, and coping with significant stressors. Many students may engage in experimenting or recreational drug use without fully understanding the risks involved long term. Young adults believe that prescription medications are safer than street drugs. Unfortunately, because counterfeit pills are containing fentanyl closely resemble legitimate medications, students may unknowingly place themselves at risk for dependence, overdose, and death. In conclusion, fentanyl is a highly potent synthetic opioid that was originally developed for pain medication. College students represent a vulnerable population due to stress, mental health challenges, social pressures, and accidental exposure through counterfeit pills. The drug's ability to reproduce dependence and its high risk of fatal overdose make fentanyl addiction an important issue that requires increased education, awareness, and prevention efforts among young adults. Thank you for listening.